If you are a man over 40 and you have noticed changes in your erections, this may not be about what is happening in the bedroom. It may be about what is happening in your blood vessels. I understand that is not a conversation most men are keen to have, but stay with me, because what I am about to explain could genuinely change how you approach your health, and in some cases, it could be the warning that saves your life. Men can now walk into a pharmacy in many countries and purchase medication for erectile dysfunction without seeing a doctor. And I understand the convenience. I understand the appeal of removing the embarrassment factor from the equation. But here's what concerns me about that. What if the reason you need that medication is because your entire cardiovascular system is beginning to show early signs of disease? What if you are treating one symptom of a much larger problem, bypassing a doctor, missing the underlying diagnosis, and allowing the real damage to continue progressing quietly for years? Erectile dysfunction is not just a sexual health issue. In men over 40, it is frequently the earliest visible sign of cardiovascular disease. Not a symptom occurring alongside it, the earliest sign, before chest pain, before a heart attack, years before. My name is Dr. Victor Hayes. Let me explain the biology, because once you understand it, this all makes complete sense. An erection is a vascular event. That is the fundamental reality. It is entirely dependent on blood flow and the health of your arterial walls. When arousal occurs, the nervous system releases a signaling molecule called nitric oxide. Nitric oxide is one of the most important molecules in cardiovascular medicine. It tells the smooth muscle and blood vessel walls to relax and dilate. We use nitrate medications in emergency medicine every day to exploit this same mechanism, opening coronary arteries during angina or heart attacks. During an erection, nitric oxide causes the penile arteries to dilate. Blood rushes in, filling the spongy tissue inside the penis. Simultaneously, the veins, which normally carry blood back out, compress and close off. Blood is trapped. The erection is maintained. This entire process requires healthy blood vessels, functioning endothelium, the inner lining of your arteries, adequate nitric oxide production, and flexible, responsive arterial walls. Everything in that sequence depends on vascular health. Now consider what happens when atherosclerosis begins, when arterial walls stiffen, when the endothelium is damaged from years of elevated blood pressure, high blood sugar, or inflammation. When nitric oxide production begins to decline, the machinery of an erection stops working reliably. The vessels cannot dilate as efficiently. Blood flow is insufficient. The erection is harder to achieve, harder to maintain, or the quality simply is not what it used to be. Here is why this is such a powerful cardiovascular warning signal. The penile arteries are small, approximately 1 to 2 millimeters in diameter. The coronary arteries supplying your heart are 3 to 4 millimeters in diameter. When atherosclerosis begins, when plaque starts accumulating in arterial walls, it produces symptoms in the smallest arteries first. A plaque that causes a 50% narrowing in a 1 millimeter artery produces symptoms immediately. The same plaque in a 4 millimeter coronary artery causes only a 12 to 13% narrowing. You will not feel that. There is no warning. The disease is present and progressing, but the larger arteries have enough reserve capacity to absorb the damage without announcing it. This is why erectile dysfunction can appear 3 to 5 years before the first symptoms of coronary artery disease. 3 to 5 years before angina, before a heart attack. The body is sending an early warning through its smallest vessels, while the larger vessels are accumulating the same disease without yet crossing the symptom threshold. That warning is being ignored or suppressed with a tablet purchased over the counter, while the underlying arterial disease continues progressing in the vessels that keep you alive. The evidence behind this is substantial and consistent. Erectile dysfunction is strongly associated with hypertension, insulin resistance, type 2 diabetes, elevated LDL cholesterol, smoking, and abdominal obesity. All of the classical cardiovascular risk factors. Studies consistently show that men with erectile dysfunction carry a significantly higher risk of major cardiovascular events, heart attacks, strokes, and all-cause mortality, even after controlling for other risk factors. The association is independent. It persists even when every conventional cardiovascular risk factor is accounted for. What should you do with this information? If you are a man over 40 and you have developed new erectile dysfunction, or if you have noticed a progressive decline in erectile quality, please do not simply purchase medication and move on. Use this as a screening moment. This is information your body is giving you. It is worth paying attention to. See your doctor. Ask specifically for blood pressure measurement, because hypertension is frequently silent and causes significant endothelial damage that most men are unaware of. And HbA1c, your 3-month average blood sugar, which reveals insulin resistance and prediabetes long before fasting glucose becomes abnormal. A full lipid profile including LDL, HDL, and triglycerides. A waist circumference measurement, because visceral fat is a direct driver of insulin resistance and vascular inflammation. Then have an honest conversation about your overall cardiovascular risk picture, including lifestyle factors, smoking, exercise, diet, chronic stress, and sleep. Here is the particularly encouraging part of all this. The interventions that improve erectile function are exactly the same interventions that improve cardiovascular health. Not different lists, the same list. Regular exercise, particularly a combination of resistance training and aerobic activity, improves nitric oxide production and endothelial function, reduces blood pressure, and improves insulin sensitivity. Weight loss, particularly reducing visceral fat around the abdomen, dramatically improves vascular health and insulin regulation. A Mediterranean-style dietary pattern, oily fish, olive oil, vegetables, legumes, nuts, has strong independent evidence for both cardiovascular benefit and improved erectile function. Your erection is a barometer of your vascular health. If it is improving in response to lifestyle change, your arteries are almost certainly improving as well. If it is declining, that is information, a signal that deserves a clinical response, not suppression. The biology here is actually optimistic, because unlike many chronic disease conversations where we are discussing damage that is already irreversible, we are talking about catching something early, when the vascular dysfunction is still in its early stages, when lifestyle change can genuinely reverse the process rather than merely slowing it. The men who act on this signal early are the men who prevent the heart attack that never happens. No drama, no ambulance, no intensive care, just another ordinary day, because they recognized an early warning sign that most men simply ignore. Please share this with the men in your life who need to hear it, and subscribe to this channel for more evidence-based content. I will see you in the next video.